Hello, welcome. Before we get started, I just wanted to point out that I was like, oh, Aliya, hold on one second. I'm going to move this microphone out of the way. And so as I'm moving the microphone out of the way, she's like, nice tramp stamp, Renee. Yes, I will just say it now. I have a tramp stamp. Also, like, when did it start to become, like, why is it called that?
I don't know. I didn't make it up.
Like, now that I think about it, like, that's not nice. That's not a nice, like, because tramp, we don't really use that word anymore, but
It was mean of me to say it that
no,
way.
no, no, no. That's what it's called, though.
That's what it's called. Yeah.
Like, fair enough. Anyways, it's the Canadian volleyball symbol. I got it when I was 18. It's very faded, and I always forget that I even have it because you don't see your lower back
Yep.
often. So, yes, there it is. And also, just like a free idea for people before we get into the actual topic of the podcast. Aliya has a tattoo of her son's name, but she brought in, I guess, like a picture or an example of how he used to write it when he was little. And
Yep.
they did that on, like, I'm so doing that.
It was so cute. It's so cute. It's so jacked up. Like the N is backwards, the Y I think is backwards. The E has 4 lines, but it's so cute. And every now and then he sees it and he's like, um, well, now his printing is much better than it was then. I think he was probably like 3 or 4 when he wrote that. Now he's 8. So he said, that's like my autograph. And I was like, yeah, it is. And he's like, when I get bigger and I have a better autograph, will you put that on your body? And I was like, I don't know, son. You're asking for a lot.
Yeah. Maybe
It
if
won't be
you
cute.
win an Oscar or something.
Right. If you're famous, I don't know. Even still.
Yeah. Oh gosh. Okay. So this episode is all about prolapse, which I feel like usually if I would do a podcast on pelvic floor stuff, it would be very general and we would cover a bunch of topics. But my friend messaged me literally the other day and she was like, do you follow or are you friends with Fox Wellness Co? That's Aliya's name on Instagram. And I was like, yeah. And she's like, her content is the only content that I've come across about prolapse that is not super doom and gloom and like actually made me feel better because she's concerned that she might be dealing with prolapse. She hasn't been assessed yet, but she's has the appointment booked. And I was like, that's so lovely. And she goes, you should record an episode with Aliya about prolapse. And she was like laughing. And I'm like, okay. And like 3 days later, here we are.
I love that. And I love that your friend feels that way because prolapse can be a really scary diagnosis to get. And it can feel maybe, I don't know, maybe even more scary when you're not sure if you have prolapse, but you feel something weird going on down there. It's like it's a really emotional diagnosis. There's an emotional component to it. So I'm glad that she feels that way from the content that I put out there on Instagram. And after you had reached out to me, I was like, I actually don't talk about prolapse enough. I really don't. So I'm glad that from what she sees and from what she kind of like takes away, that she feels empowered and not scared. But I do feel motivated now to kind of put out some more stuff around prolapse because it's actually ridiculously common.
And that's what she was saying. She's
Mhm.
like, I can't find, I guess more so as opposed to like, you Google prolapse and you go to these like random WebMD pages that are just, not very like personal, you know what I mean?
Yeah.
So when it comes to trying to find content that is actually relatable and makes you feel good and makes you feel like other people are going through this and you're not alone and that there's like, options for you. I
Hmm.
think that's the kind of content that's missing when it comes to prolapse. So, yeah, definitely we need more conversations like this and just more out there about it. To start, I thought we could discuss what prolapse is in the first place.
Yeah, that's a good question. We can all make sure we're speaking the same language.
Yeah.
So, a prolapse, and in this case, I'm pretty sure we're talking about a pelvic organ prolapse here. So, sometimes we'll see that like the acronym POP or POP for pelvic organ prolapse. And pretty much what that means is that one or more of the pelvic organs is sitting lower in the pelvic cavity than it used to, right? Like we have a pelvis. It's like imagine a fruit bowl. Okay. You have a fruit bowl, which is your pelvis, and you have like a banana, an apple, and a mango in there. And before it, was held up nicely, I didn't think about this analogy very well, but
No,
a
it's a great
prolapse would,
one.
okay, I'm going to keep going with it then. So a prolapse would be at some point as life goes on, or after birth, or after like taking really hard shits for 20 years and having to like really
Oh.
strain to get it out there, or being a chronic cougher, for example, the banana sits a little bit lower. Now the banana is like sitting a little bit where the mango used to be, a little bit lower in the fruit bowl. So prolapse, I think people think about that, or they've heard from like a grandma or an aunt or the internet that like my organ is just falling out of my body. And I think
Mm.
that is like firstly a really horrific visual to have. And of course that's like a really scary thing to think about. But really what it is just there's like a descent or a lowering of one or more of the pelvic organs. And our pelvic organs as females, we have a bladder, a uterus, and a rectum. So, more commonly, we're talking about one or more of those organs just sitting lower. And what helps to hold them in place is things like connective tissues and ligaments and fascia, and also muscular support to help to hold things in place. Now, when the integrity of one or more of those things is maybe compromised, then we'll have things shifting in our pelvis and sitting a little bit lower, and not sitting lower such that necessarily one day you're going to sit on the toilet and like wipe after going pee and like your bladder is going to be in your hand. It's not that. It's actually more like the organs are crowding into the vaginal canal.
Mm. So do men deal with this? Because when you think about like a woman's anatomy, like you said, the vaginal canal, but men don't have like this big opening into the world. Do you know what I'm saying? So do they experience this or no?
No, this is like, one of the pleasures
Ah,
of yeah.
hashtag
So no.
blessed.
Hashtag less. No, this is a us problem. And it is exactly that, right? Because of the way that like anatomically we're constructed, there are areas of deficiencies there that naturally exist. And so when that anatomical support, right, the ligaments or the fascia, the connective tissue, the muscular support, when there's a defect there, then we can have things sitting lower. And what we um like I kind of sometimes I like to describe this to people as, imagine that you have really annoying neighbors. You live like in an apartment, or like I live in Toronto, I live in a row home, right? So I'm connected to my neighbors on both sides. Um, and so it's kind of like imagine that my house is the vaginal canal. My neighbors to the right, they're the bladder. And my neighbors to the left, they're the rectum, where the poop hangs out. Let's just say that the neighbors to the right are my bladder. They're like so noisy. They're keeping their windows open. They're smoking. They're up all night. They're playing their music super loud. They have dogs that run around. Like they're annoying me, the vaginal canal, right? So it's more like that. It's like the things on either side of the vagina are crowding into the vaginal canal, and what we can feel is that there's something down there, like we feel pressure or we feel heaviness, or we may be able to feel something. If we put a finger or two up there, we might be like, oh,
Mm,
that's weird. Or we might see something. We might see like a bulge or something that looks like the inside of your cheek, like like soft and
mm.
squishy and kind of red. We might see something there. If we've looked or felt down there before, and so we know what our normal is, we might be like, that never used to be there if we're looking or feeling again.
So I'm assuming it's common after giving birth because, like you said, it can happen after straining.
Right.
So pushing out a baby or even just being pregnant and having pressure on that
Totally.
area.
Yeah, totally. So vaginal birth is one of the main kind of, I don't know, risk factors or kind of contributory causes to having a prolapse. I think the studies say that it's like the first baby and the second baby. And then after that, there's like negligible worsening of a prolapse. So yeah, vaginal birth would be one of the, like the major risk factors if we're pushing, especially if we're pushing for a long time, right?
Mm.
If we're pushing for a long time, that's a lot of like sustained downwards pressure that we're putting for, you know, sometimes hours it can be. So that would be one of those risk factors, but also things like being chronically constipated. So every time you have to poop, you're like really straining and pushing quite hard, or even having like a chronic cough. This can be like when you cough, that's a lot of pressure downwards. So if you're someone that has a chronic cough, like long standing situation, like that could be a contributory factor too. And you know, the research that we do have says that there's some other kind of like more low correlation between developing a prolapse and things like family history, or if you're like, you know, if you had a forceps in the delivery
Mm.
that you had, like a vaginal birth with tearing or forceps, like there's some low correlation there. Um, yeah, BMI, right? So body mass index, there's some low correlation. But what's neat, which I really love, is that there's not really any research that confirms that things like lifting heavy stuff causes prolapse. So, and I know that's interesting because a lot of people, firstly, when they're given a diagnosis of prolapse, they might be told by their medical provider, oh, it's fine, just like never lift more than 10 pounds or never lift more than 20 pounds. If you're a mom, your kid is probably 20 pounds by the time they're 1 year
Mm-hmm.
old, right? So that is a really disheartening thing to hear. Our brains go, oh my gosh, I won't be able to lift my kid when he's 2 or 3 because he's going to be too big. I'm not supposed to. I can't go to the gym and lift heavy things when we know the research tells us that lifting heavy things is really important for us as women for our overall longevity and our health, especially as we age. So all of a sudden, we're instilling this fear of movement, fear of strength training in women when that's like actually the opposite of what I think we need to be doing because there's no research that proves that lifting heavy things in the gym worsens prolapse. I think there's some suggestion that it actually like improves symptoms, which is great.
Hmm. That's
Yeah.
wild. Just
Yeah.
a side note about the pushing poop out.
Yeah.
I realized this the other day, like when I'm like, I never strain to poop. Like I can't be bothered. Like even if I feel like there's something there and I'm like constipated and I'm like frustrated, I will never strain. I'm just like, well, okay, it's not happening. Like move on with my day.
You'll just
Like,
come back later.
yeah, like screw it.
Mm.
Like
Yeah.
I
Yeah.
can't be bothered. Like, is that like what's recommended?
Yeah. I mean, I think that's a good strategy, right? Like don't force it out if it's
Yeah.
like, but sometimes when you have a big poop or a hard poop and it's like right there, it's like at the door.
Yeah.
Sometimes like we do need to create a little bit more pressure, but we can create pressure without holding our breath and bearing down, right? There's a difference in terms of like what's happening in our body when we hold our breath and we like strain
Yeah.
like that. And in some of us, we actually like if we're talking about poop, we actually like close the sphincter, like we squeeze our butthole when we hold our breath to push the poop out. And that's like counterproductive. Like you're
Right.
closing the hole and trying to get something out. So we can end up with fissures and even hemorrhoids and stuff like that from doing that. But anyhow, if we need a little bit of a push for the poop to come out, you could try to like breathe into a fist, like, right? Like really force the exhale out. So you're not straining so hard that you're creating potentially damaging pressure down there, but you are giving it a little bit of a nudge by increasing the intra-abdominal pressure in your body.
Have you ever heard about research? Yes, I like Google and read these random PubMed articles.
Yeah.
I came across these articles that was saying there's actually research that shows that if you press on your perineum, it will help the poop come out. And like I've
Yeah.
tried it a few times and it freaking works. It's
Yeah.
nuts.
Yeah, for sure. That's actually a strategy. We call it splinting in the pelvic health world, where you can support the perineal body. So that's a space between the vaginal opening and the asshole. You can support that like with your hand. Or you can actually like insert your thumb into your vaginal opening and kind of push back towards your butthole. And that is if you have a prolapse of the rectum. So if the rectum is kind of pushing into the vaginal wall, it can create a little poop pocket. and your poop can get stuck there. And like some of it can get stuck there. So if we have a rectocele or a prolapse of the posterior vaginal wall or the back vaginal wall, some of the symptoms that we might experience is like we have a poop and we get up and we're like, why do I feel like I didn't get it all out or having a hard time getting it out? So supporting the perineum externally, like you said, or sticking a finger up the vagina and kind of pushing towards the back, that supports that loose wall where the organ is kind of pushing in. And yes, that's a great strategy. Good for you. I love that you figured that out and you did it.
Yay, research. Um, Free idea for somebody or even you. Like, we need a product to do that. Like,
I
this is
think
one
there
of
are
those things.
products. There are
Oh,
products.
really?
I think there is a product. I feel like I came across it somewhere where it is something in my, I don't even know what it's called. Um,
Okay, well, I
but
gotta
to
Google
me,
this.
yeah, to me, it looked like a shoe, like a shoehorn.
This is genius. Like, it's so, like, nobody talks about this stuff.
I
Like,
know. I know. We need to talk about the nitty gritty. So people are going to be listening to this and be like, ew, you want me to put my hand in the toilet bowl when I'm pooping and put my hand there? And so I usually tell people, like, go to the dollar store or go on Amazon and order a box of gloves, right? Like medical gloves or whatever. And
yeah,
like put a glove on or like wrap your hand in toilet paper. Like it's going to
that's
be
what I
okay.
do. I'll like put a bunch of toilet paper at the end of my hand and just like press on the perineum and it's like, boop.
The thing is that if this helps you, like it seems to help you, people will do anything to have a great poop, right? Like people will alter their diet and do all these kinds of things because when you have good bowel movements, like life is just better.
Oh,
It's
yeah,
really
it
good
is.
for your overall health. It's really good for the way you feel. It's really great for your pelvic health. So one of the things is, if anyone is listening and they think or they know they have a prolapse, managing constipation and avoiding constipation is one of the kind of lifestyle things that we should really be working on and trying to get a poop without straining. So these strategies might be helpful for somebody.
Love it. See how I just like weaved that in there and it all makes sense.
You're a pro.
So, is there anything women can do? Let's say someone is going to have a second baby. Maybe someone's listening who is pregnant, hasn't had their baby yet. Is there anything that people can do to try and prevent prolapse from happening?
I think there's things that you can try to do to prevent it for sure. I think that, are you talking about like the example that you gave someone who's going to be having a baby soon or just in general principles?
Just like let's say someone's pregnant or
Yeah.
they're pregnant with even their second child and they didn't have a prolapse previously, but maybe they're concerned about it and want to do anything to prevent it. If
Yeah.
if that's possible.
Yeah. I would say for sure, like during pregnancy, as much as possible, manage that constipation. And it's hard during pregnancy to manage constipation because sometimes things like prenatal vitamins or iron supplements can really make us have hard poops. And then, gut motility or the way that, food waste moves throughout our body is slowed down because of hormonal changes during pregnancy. So it's sometimes an uphill battle, but managing constipation as best as possible during pregnancy is important just to decrease the amount of load on the pelvic floor structures, the muscles and the soft tissue, the connective tissue that help to hold things in place. You can't control, and you also want baby to continue to grow and thrive while you're pregnant, right? So that's a ongoing increased load and stretch down on those structures. You can't control that, and we want that to happen, right? So we can't change that. But if you are constipated for those 9 months of pregnancy, that means that you are likely working hard and likely straining to get the poop out. When you're not pooping, your rectum and therefore the structures of your pelvic floor are working quite hard to hold up this hard and heavy poop, right? It's just one more thing for your pelvic floor structures to have to support. So if we can minimize that as best as possible, that can help for sure. And then when it comes to like preparing for birth, the planning your birth, what to do, how to think about it, I think there's benefits in learning how to push in different ways, right? Like we can bear down and close all of our glottises and kind of do this purple pushing, right? Where, they often coach you at the hospital. I don't know if this was your experience, but it certainly was mine. And it's the experience of many of my patients where they say, all right, it's time to push now. Take a deep breath, like hold your breath and we're going to count to 10 and just push like you're taking a poop. And so that's like encouraging people to hold their breath and push against that. There's other ways to push. You can push while keeping your glottis open. And that might look like a forced expiration, pushing while letting some air escape from your mouth. That can sort of mitigate how much pressure is going like downward. So it's a more controlled pressure. And I mean, there's good research behind that too. Apparently there's better fetal oxygenation when we're not holding our breath and pushing for 10 seconds. So that's a good thing. But it is a good way to practice pushing so that you have that option when you're actually in there in the moment. So that's important. And also learning about different positions that actually make birth easier. Positions can actually create a little bit more space for baby to come out, both not just like out the pelvic floor door, but just move within the pelvis. So thinking about a position where maybe you have freedom of movement for the back, for your sacrum, which is the bone at the back of your pelvis, and your tailbone. When we're lying on our back, we don't have that much freedom of movement of those two bones. And so the space that baby has to exit is kind of fixed. Whereas if we're more upright, or if we're on our side, or if we're on all fours, you can imagine the tailbone and the sacrum, the bone above that, is able to kind of move out. And they're designed to move a little bit to create a little bit more space. And we can do other things. We can change the rotation of our knees, our hip joint rather, to create a little bit more space on the bottom of the pelvis. So these are things that I like to teach people who come to see me, or people who take, like, I have online courses about like preparing for birth, and these types of strategies can certainly help. But I mean, I feel it makes me feel icky to say,
Yeah.
if you do this, like, you won't get a prolapse, because like that's irresponsible. Like,
Because
no
like it's
one's gonna.
someone's fault that they got it. Yeah. Yeah.
Right. It's no one's fault. That's just the way that it is. And, there is a very high incidence of us developing prolapse. And also, I just feel like that's like a shitty marketing technique that I don't subscribe to. So these are things that you can do, but we can't, like, there's
There's no
nothing out there.
guarantee. Like it's
Yeah.
just, yeah.
Yeah. Yeah. These are, but I do for sure recommend these types of things for sure.
I'm surprised there's no, and maybe there has been, because so many people obviously get an epidural, they give birth on their backs. I'm surprised there hasn't been something developed where like you're laying on something that like opens up the pelvic floor, or like you're in a certain position. There's like some fancy pillow that women lay on their backs on that creates more space, or
I
does that
mean,
exist?
no, but what does exist is a sheet, and you take the sheet and you roll it up and you make a U. Or if you don't have a sheet, you take like two pillowcases and you roll them up, and you place like the two pillowcases under each butt cheek. So if you imagine lying on your back and you have like a little pillowcase roll or a towel, right? Like under each butt cheek, your tailbone is lifted a little bit off of the bed. You don't need like a ton of space. It just needs a little bit of freedom of movement. So you can do this type of a hack. And I teach these types of tricks to my patients all the time. So take like a sheet, roll it up, make a U, and kind of place the U
Yeah.
at the base of your spine. And like this part of the U goes under each butt cheek. And then you're kind of creating a trough for your tailbone and sacrum. And that will do exactly kind of like what you're saying, is like creating a little bit more space.
Free idea to
Free
develop
idea.
like a birth pillow like that.
Yeah, but then you gotta get buy-in from like all the birth providers. That's the problem here.
Yeah.
It's really slow for, I think, things to move down into like a hospital, for example, like to.
But can't a woman just bring it herself?
For sure, you can, but I don't know. Maybe they'll say, "Oh, you can't use that because," as the OB or the doctor may say, "I don't have like, I can't see well." And I understand that point of view, because if there's an emergency and I was giving birth and something was happening, I would want them to like get in there and fix the problem as soon as possible. So, I mean, I don't know. I feel like, yes, you could bring that. And
Dragon's
hopefully,
Den.
yes. Yeah, in the Dragon's Den. In the near future, hopefully, like, these won't even be conversations. These will be things that like the nurses and the OB is like, this is how you can give birth easier. Let's try
Yeah.
this, as opposed to us bringing it there and being like, my pelvic floor PT told me, and
Oh
or I
gosh.
read this on the internet.
Yeah. Okay, before we get into other prolapse things, I wanted to hear your story and your experience with it. To maybe, shed light on what it actually looks like, what it feels like, what you've done, and yeah, any advice that you have for people or
Yeah, I'd love to share. I don't really talk about this like too much on my Instagram. I don't know why. I feel like I struggle with wanting to just be like an educator, like an impartial, like these are all the things. And occasionally I'll talk about it, but it's not like the mainstay of what's out there. So if someone's looking for this on my Instagram account, they might have to dig really far to like find me talk about it. But this is making me maybe want to talk about it a little bit more because I think it does make people feel seen and understood, and maybe it can provide some hope for people that there is like life is fine. You can do all the things. Um, so my story is kind of like I didn't know that anything was going on. I didn't have any symptoms of prolapse until I think my son was he was over a year and a half. Yeah, yeah. So, I pushed for a long time with him. I was in labor with him like from beginning to end for like almost 48 hours. And my pushing phase was very long. It was like, I can't, it was a long time ago now, but I feel like it was almost 3 hours. It was really long. So that would be a prolonged pushing situation. And I had a perineal tear, and I had some other stuff that is like pretty classic when you push for a long time. Like I had a whole bunch of hemorrhoids, and I remember like when I got admitted to the hospital and it was like finally like I was dilated enough. I was just like a very slow progressor. The doctor that admitted me, by the time it was even time for me to push, like she was done her shift. So someone else delivered my baby. And then the next day, that same doctor that admitted me came to do a little postpartum check on me. So she checked down there, and I mean, I thought she was very nice. However, I don't appreciate the bedside manner because she kind of was like, whoa, like she had this like huge reaction when she looked down there, and she said something like like you really got some good hemorrhoids. I was like, that is the worst possible reaction that you can have to someone who feels like their insides are literally on the outside, because that's kind of what it feels like when it's all fucked up down there. So I'm not over it yet. I still probably should go to therapy for that one. But yeah, so I had stuff like that, and that healed in like a normal-ish timeline, few months, whatever. I didn't have any of the classic prolapse sensation, which is like a bulge down there or feeling something down there. And I did like, do some strength training, and I did some home exercises for a while. But it wasn't until he was over a year and a half that I really started to feel like I had good sleep, I had good energy, that I had the capacity to like actually do more dedicated exercise and start to lift a little bit heavier still at home. And as I look back on it, I think that it's not fair to just blame it on my poor kid for, taking a long time to come out, because when he was about a year and a half, I remember that I got this really bad respiratory virus, and I was coughing so much that I actually thought that I dislocated or like even broke a rib. And that sounds really crazy to say, but I was in excruciating pain. I remember having like a brace, a belt. I had like a belt, and I like ratcheted it really tight around my rib cage because that was the only thing that made me feel okay. I was coughing so much for a while. And then it was after that I like started to lift a little bit more. And then I was doing deadlifts with a moderate weight, but not very heavy. It was still at home. So I think it was maybe like 50 pounds, like, which is good, but it's not a lot.
yeah.
And I was like, what do I feel in my body? And I remember the moment. It's like I'm looking at my basement. I was right there. And I didn't like that. And then I like went upstairs and I like looked down, and I was like, something is coming out of my body. And like, this wasn't there before. And I was really distressed by all of this. So anyhow, so that's kind of when it started. And then, so that was like between a year and a half and two postpartum. So a long time. So I don't know. I can't go back in time and figure it out. Did I have this before, but not have symptoms, which is extremely common.
Mhm.
Many of us will have what's called like an anatomical prolapse, which like if you were to have an assessment by someone, they would do like specific tests, and they'll be able to see that one or more of your organs is actually sitting lower. But it wouldn't be considered these days, by the guidelines that we follow now, it wouldn't be considered a clinical prolapse unless you had symptoms that were bothersome, right? So many of us have an anatomical prolapse. So maybe that's what I had. And then I didn't feel symptoms until I kind of pushed my body beyond maybe what it was capable of, or maybe I had that terrible cough and it made it worse. I'm not really
Mhm.
sure. But that's kind of where it started. And I was really upset about the whole thing. And I had symptoms, like something was coming out of my vagina all the time, like 90% of the time. I felt it when I walked. I felt it especially when I lifted. And I think the part that made me feel the worst was, do you remember when Milo was young? Did you ever do the thing where like you and your husband he'd be in the middle of you and your husband and you'd have one hand of Milo and he'd have the other and then the kid swings in
Yeah.
between? So that would make my symptoms the absolute worst. And he was at that age, like 2, like that's all they want to do. They just want to like swing around and be little monkeys. And I remember that was actually really distressing for me. And that made it hard for me to, like, on an emotional level, to be like, oh my gosh, I won't, like, I have to ask him to stop doing this. Like, I can't tolerate this. I'm not going to be able to like lift him in and out of his crib. Like, I was really going places. So that was really hard emotionally for me. And then I sort of, you know, just kept doing the things and I kept trying to strengthen my body, not really necessarily focusing on strengthening my pelvic floor per se, but more like strengthening all the supportive muscles too. So just having like a really strong core, having really strong glutes, making sure that I wasn't actually like holding or clenching my pelvic floor, because that sensation is so gross that it's like a reflexive action for many, like myself and also with my patients, is like you suck everything in down there because you want to like pull the organ up because that sensation is super gross. But what we have, or what can happen when we do that, is we can like get into this pattern of having overactive muscles down there. And that can lead us down another road. And that can actually make symptoms of prolapse feel worse. When we have muscles that are constantly tight down there, it can actually mimic a similar pressure feeling. So it was a lot of like balancing stretching and mobility work and a ton of strengthening. And like I used to be at the point where uh, I would do like one sit up and I would feel pressure just with a single sit up. I would feel pressure, like I said, doing deadlifts. Like certain things would just make my pressure worse. So I started to kind of ignore the pressure somewhat and just keep doing the best that I could, paying a lot of attention to making sure that I wasn't constipated, I wasn't holding my breath. And over the months and the years, like now, I don't know, 99% of the time, I don't have symptoms. And if I do have symptoms, I know that it actually has nothing to do with what I've done. It doesn't have anything to do with a hard workout that I did. It usually has to do with my cycle. And because
Oh,
I have I have an IUD, I don't really know too much about when I get my period. So I'm just, because the hormonal levels can change things in our body. So I'm usually like, it has nothing to do with me. Maybe I'm stressed. If I don't work out or if I'm like taking a break from the gym, I often feel that my symptoms are worse. So for me, like having strong glutes, having a really strong core, being active, having a great poop, like these are the big things for me. And now, like, I can deadlift much more than my body weight. I can squat more than my body weight. I can do pull ups. I can do push ups. I can do sit ups, like 50 of them in a row with no pressure. So it's the symptom I think that's most distressing. And I do not go down there and check to see what I can see because, from a clinical treatment standpoint and also supported by research and practice guidelines, like treatment, which can look like many things that I'm sure we'll chat about, but like success would be having less symptoms.
mm.
Success isn't necessarily going to be like reducing the stage of the prolapse or making the organ go back where it's going to be. It's probably not going to be able to go back.
That's what I was going to ask. Like, is there any research or anything where it's like someone is assessed, they do all the things, and then they're assessed again, like with imaging or like internal exam, and the actual organ that has been coming down is gone up further? Or is it just like you're you're feeling it less?
Yeah, like the treatment success would be more of like symptom management or symptom reduction or symptom resolution. I think that the research would support. I'm pretty sure I was reading this yesterday. I'm pretty sure it says that like conservative treatment, right? So like exercises, pelvic floor muscle training, the right type of muscle training, holistic kind of stuff, right? Lifestyle strategies, constipation management, whatever. It can reduce the actual anatomical level by like half a grade or something like that. Like, don't quote me on that. It's going on a podcast, so it's going to be out here forever. But it's really like exercise, like pelvic floor muscle training, cannot like put it back where it was, right?
Okay.
But it can change the symptoms. Like if you think about it, um, do you ever use those hair ties that are like the curly rubber ones?
Mhm.
Do you know when those get like stretched out? Do you know the trick to get them to go back to how they were?
No.
You can pour boiling water on them.
Oh.
Yeah. So if you don't
And
understand that, you're
they
not
like coil back up?
they coil back up. Yeah. So, but then, like the more traditional, like the regular, I'm looking around my desk. I don't have any, but like the regular rubber hair ties, once those stretch out, like then you just throw it away. You
Yeah.
can't do anything to it to get it back. So if we think about the structures that support our pelvic organs as if they were hair ties, right? The muscles that give support to the organs, they don't do all the holding up on their own. They support the organs. Those muscles are like the curly rubber coiled hair ties. So you can strengthen the muscles appropriately. You can make sure they have good mobility. You can strengthen the muscular support around. And that would be like pouring boiling water and getting the muscles to be back to a better functional supportive length. But if you think about the ligaments and the connective tissue and the fascia that might be damaged or stretched out or perhaps torn with that downward constant pressure, whether it's vaginal childbirth or chronic constipation or whatever it is, those structures are more like those old fashioned hair ties that once they stretch out, they stretch out. So the studies and the guidelines kind of say that we can expect to reduce maybe the grade by half, but not anything crazy. But what is better is symptom management, and that's
Mm.
actually like what matters, I think. And so I often encourage my patients not to get so stressed out about like checking down there all the time and asking me to check all the time and to see like what level are we at or what stage prolapse do I have. Because even the guidelines these days are suggesting that if someone comes in and they have an anatomical prolapse that's like really severe, right? So anatomical meaning the position of the organ, not what they feel, but they have zero symptoms. They don't feel pressure. They don't have any functional problems, like they're not having problems with their bladder or bowel function. Really, that's related to the prolapse. Then there's no treatment that's typically indicated for the prolapse itself, right? So it wouldn't be considered a clinical prolapse. So I guess the takeaway is that the level or the stage is less important than the bothersome symptoms, because those
Right.
bothersome symptoms, they impact our quality of life. They impact our mental health, our mood, maybe our relationship with our partner. We feel like they're going to know that there's something down there. Maybe we won't do activities that we enjoy because our doctor told us not to, or we're scared to make it worse. So I think that, yeah, symptom management is the goal, and we can get good symptom management.
So I'm assuming the treatment options are things like strengthening. Um, I know, well, because my husband's a urologist, a pessary. Can you
Yeah.
explain what that is? And also, at what point, like if somebody's diagnosed with a prolapse, and like at what point does someone consider a pessary? But first, maybe like what is that?
A pessary is amazing. A pessary is like a sports bra for your vagina.
Yeah.
Like you can go for a run without a bra on. You can. You're not going to be not able to run, but you'll be much more comfortable if you have a supportive bra when you go for that run, right? So it's similar. If we think about a pessary as like just like a tool or like something that can help us perform better or feel better. So what it is something that goes internally into your vaginal canal, and it provides support to the organ that might be pushing into the vaginal canal or dropping lower into the vaginal canal. So it helps to kind of reposition or provide support. It can change and kind of take away that annoying sensation of the bulge, because there won't be the bulge because it's going to be supported by something. Um, and yeah, and basically they come in different shapes and sizes, and you typically need to be fit with one that fits not just the size and shape of your own body, but which organ or organs might be bugging you. Um, so I say that like they're great. I have no for a while, I was like, I'm going to get myself a pessary. Like, I don't want to feel this all the time. I don't want to feel worried about all the things that I'm doing. I just want to put a pessary in and move on with my day. So far, I'm fine, but I have no problem revisiting this if, like, as I go through perimenopause and menopause, if I experience changes and like I have symptoms again, I'm just going to go get a pessary. They're just like you put them in and you take them out. It used to be something that I think was like really associated with really old women.
Yeah.
Um, and I think that's no longer the case, but they need a good PR, good PR package or something to rebrand.
Yeah. I got to get him to talk about them. And is it the thing that's like the mesh lining?
No, so that would be like a surgical repair of a prolapse.
Oh,
Yeah.
okay, okay, okay.
So a surgical repair of a prolapse I'm not a surgeon, so I'm just gonna like talk very high level about it. But it's kind of just like where they would go in and use mesh or other types of techniques and structures to help to pull or
Right.
support the organs back in place, because maybe the ligamentous support is so compromised that even if you've done all the things, you're still not having resolution of your symptoms, or you're having bothersome functional problems with your bladder, bowel, whatever it is.
Yeah. Okay, so that's what I was thinking of. So a pessary is different. It's like,
Yes. Imagine like a tampon.
yeah.
That's like a tampon, but it just looks different. And even sometimes people will use like a tampon to see if like something inside helps to support the walls. So like if you think about it, I'm like using all of these funny little analogies today. So if you if you think about like your face, your face is your vulva. Okay.
Perfect.
Yep. Your labia would be like your lips, right?
Mhm.
And your vagina, like the canal, is like the inside of your mouth. When your mouth is closed, what shape does your mouth make when it's closed, like at rest?
Like a horseshoe?
Yeah, it's kind of like closed,
Mhm.
right? It's not like like open on
Right.
the
Right,
inside
right,
at
right.
rest. So that's actually what your vaginal canal is. Like at rest, it just kind of like collapses. It's closed. It's not like a tube, like a toilet paper roll inside all the time. It's collapsed. So if you have a bladder that's like pushing into that collapsed wall at rest and it's giving you sensation of something bugging you
Mm.
in there, or the rectum, if you put something in there in your vaginal canal and you kind of support the walls, then it can take away that sensation. And so that's what it is. So sometimes
Interesting.
people will experiment with a tampon, to see if like having something in there. There's even things that you can buy online. Uresta is a type of a pessary that's not fit to you, and it's marketed to help people not pee their pants.
Mhm.
Helps to support like the bladder and the bladder neck so that we don't get stress urinary incontinence. I think it's a great tool. So there's things like that around.
So is a pessary something that you literally like you can put it in the morning and take
Yeah,
it out at night?
yeah, yeah.
Oh,
You could,
it's not like a
yeah.
permanent thing.
No, no, no. You can put it in and take it out. So if you wanted to if you only had symptoms when you were working out, for example, or if you only had symptoms when you were gardening, I don't know,
Yeah.
you just put it in, do the thing so that you don't have to worry about it. As you're not bugged by it, you're not questioning yourself. Then you come back and you take it out and you clean it, you sterilize it, you do the whole thing. So yes,
Interesting.
there are other
Okay.
ones that I think, especially when we think about like older women who used to be prescribed and fit for pessaries, there's some that you can leave in for a long time. And you'd
Mm.
have to go into your doctor's office maybe to get them like removed and cleaned. And if you think about like an older lady who maybe doesn't have the dexterity or like the mobility to kind of like get in there and to remove it, so that's more of a different situation. But the pessaries that like I'm talking about, you get fit for your body and you put it in and you take it out as you need. You clean it, you do the whole thing.
Who does this?
So I think it's different from probably province to province and definitely country to country. Here in Canada, you can have it fit by like a gynecologist or your gynecologist, but also there's pelvic floor physiotherapists here that are trained, and they have like the whole thing where they can fit you for it. You would probably need like a prescription from your doctor for that, but that does happen here.
Are there different sizes and you're just selecting a size?
Exactly. So you'd go, exactly. There's different sizes, there's different shapes
Oh, okay.
indicated, like based on what your symptoms are. If you have the front wall that's being pushed in by the organ, or the back wall, or is it your uterus and your cervix that's dropping a little bit lower? Are you leaking pee? Like what's going on? What level your prolapse is at, like what stage is that, different shapes, the size of your own body, and then you try them. Like you try a few on in the office, you go home, you try it out, it doesn't fit, you come back. It's kind of like that. It's a trial and error. It can be a long process, which
Yeah.
is why sometimes people try, like, at home, they try a tampon or something that they can buy over the counter, and to see if that's like a good option for them longer term. But I think pessaries are great.
Yeah, I've never heard of this before. When I saw the word pessary, I was thinking about the mesh
The
lining that
surgery,
my
yeah.
husband has talked about before. Um, when you were saying like you get fitted for a pessary, I was imagining, do you remember when you were little and like you had to get, now it's different. They have like those like wands that they just like wave around your teeth to get fitted for a retainer. I,
Oh,
it's like we're in the future now. Like we don't. So I remember when I was little having like they have like a mouth guard thing that's just like a
it's like a
general.
tray.
Yes, the trays,
Ugh,
and they
yeah.
fill it with like the Play-Doh stuff, and they like push it
Oh,
up when
it
you.
made me gag.
I
Oh, that was, why did we have to suffer?
I know. And now, like when I did, when I was being like fitted for a retainer, they just pull out this like digital wand and she like waves it over my teeth and she's like, there you go. It'll be like fit. It'll be ready in a couple weeks. I'm like, what? Like there's no Play-Doh dripping down my throat. Like, anyways,
Oh,
I was assuming that you go in and they like do something like that. Like, are they like molding the inside of your, and then they get it made. But
no, not with like a traditional pessary. No, there's like specific sizes. So there are situations, of course, where you'll be in between sizes. And so you won't find a fit for you. That can, of
yeah,
course, happen. But there are some neat things happening. There's this one Canadian company, and they are creating, what is it? It's like this is from the future. It's a pessary from the future where it's like gonna fit it like particularly for you. So somehow they do some type of like scan and then they 3D print maybe this like pessary that's like fit exactly for you. Um, Gyne
that's
orthotics,
genius.
I think, is like the concept. It's the pessary from the future. So it's pretty cool. So I was talking to that company and I was like, maybe that's what I want to do actually. So
Yeah.
anyway, so I feel like as the years go by, there might be some more options, but pessaries I think are great. But having access to someone in your community that can do it, to like a doctor that has the time and the capacity to like find you the right fit. I think the pro of having a pelvic floor physiotherapist fit you is that you have like typically a little bit more time. Like they'll take more time, they'll do like a full assessment, they'll take more time to find the fit. Like we just oftentimes like we book 1 hour appointments where you go to your doctor, you go to a specialist, like you're
Five
lucky if you get
minutes.
10 minutes or 5 minutes, right? So
Mm,
I mean, we typically book longer time. It's a different model of care. So I think that is one of the pros of having a pelvic floor physio fit it. But there's, I'm sure, other pros of an OB or a GYN or your gynecologist or anyone else that fits them doing it too. So
okay, well that's interesting. Didn't know anything about that stuff. Let's talk a little bit about PeriFit. What is that? And is it something that you would recommend? I've never heard of it, so.
oh, I like the PeriFit. It's cool. It is like this device that it has an app on your phone. And the device is like maybe this big. It kind of looks like a dildo. It goes like this, okay? And you insert it into your vaginal canal, and it has sensors. It has like deeper sensors and more superficial sensors, so it can sense what your muscles are doing. And it's connected to an app on your phone, so you literally play games with your vagina. So like you get this bird to like go up and down, and you follow the path of the bird by like contracting and relaxing your pelvic floor muscles quickly, holding them, letting them go. And it does a good enough job at uh, telling when you're actually letting your muscles go. And so I think that is an important piece of the puzzle, is being able to make sure that not only are your muscles strong and they can contract and they can do it quickly and they can hold it and blah blah blah, but also that they can relax really well too, because that's a huge part of having a functional pelvic floor.
That was my problem, was she was like, I think I got first assessed when I was pregnant.
Yeah.
And she was like, okay, your pelvic floor muscles are like you're an Olympian. Like they are incredibly strong, but I
Yeah.
had to work on the releasing the
Yeah.
tension.
Yeah.
So,
It's
okay, I
common.
really like I want this PeriFit thing. My husband's going to be like, "Oh, Jesus Christ." I can just picture him.
It's, you know what?
He probably thinks it's good and I don't know, I'm going to ask him, but I could
I
just
think I think that it's good. Sorry to interrupt. I think that it's good because it gamifies pelvic floor muscle training. It makes it more interesting. Like, how fun is it to do your exercises if someone's prescribed you to do like 3 sets of 15 Kegels or whatever it is? Like, it's hella boring. Nobody wants to do it. And we actually don't have any way of knowing, like, are our muscles
doing
lifting
it
and
right.
dropping? Right. So the perifoot is good. However, I think I have like two kind of main concerns about that, but generally I'm eager about these like kind of technologies, I guess, that help us take our health into our own hands. So, but my first concern would be like, make sure that that is like the right thing for you. So go in and get an assessment with a pelvic floor physio and be like,
Yes.
I would prefer to use like some device at home. What do you think? Right. Because if you have an internal hands-on assessment, that person can tell you, just like your experience, that like your muscles are strong, but like you can't let go for anything. So maybe the parafit is not right for you because like it's really focused a lot on lifting the muscles. And like I said, it indicates when you've let go, but like maybe for you, that might not be the right thing for you at that time. So that's my one concern. And then also like our pelvic floor muscles, they don't just work alone to like squeeze and let go and squeeze and let go. So I don't know necessarily that we need to, unless we've been told by like a professional that you need to work on the isolated strength of your pelvic floor muscles, that we need to be doing that. Instead, I actually think that there's better ways to strengthen your pelvic floor muscles that are supported by research, like doing things like squats and lunges and like
Mm,
bridges and bear plank hovers, like all of these other exercises that are like full body strengthening things. If you incorporate proper breath work and you intentionally lift your pelvic floor muscles, like you can do a better job at strengthening them and activating them. So those are my kind of two concerns. But if you need to go to pelvic floor physio and she's like, oh, you need to come like every week for 6 weeks. And you're like, no, thank you. I'd rather do these games at home. Then maybe that's a discussion to have with you and your practitioner.
it's like you can't just do that in isolation and not take care of everything else as well. You know, like
Yeah,
it's almost like you don't want someone to just rely on doing that and that's it.
yeah, for sure. I think like yeah, yeah, I agree. We're not going to like have like great pelvic health or necessarily fully solve our problems just by doing that. But I think it's a good piece of the puzzle for some of us. Yeah, I like it.
Free idea for PeriFit. I was just thinking, like imagine you could log into the app and so like you're playing a game but against someone else. So I'm playing against my sister who's at home and we're like like, you know,
I wonder if you can do that. I've never tried that. But then,
that
hmm,
I
I
don't
have some
know.
thoughts. It's a good idea. You're
It
really
is.
getting on this whole like gamifying pelvic floor
I
exercises here.
I know. Okay. So can you tell us a little bit about Box Wellness Co? What kind of content you put out, what kind of programs you offer, and if you do have programs or courses or classes that specifically deal with prolapse.
For sure, for sure. So, Box Wellness Co. is like this little cheeky name that I gave this company of mine, this small business of mine, because box is a synonym for like down there. And I realized like 2 years into this whole thing that many people didn't know that. So my name makes no sense, but that's what it means. It means you're a veg. Anyhow, and the concept is that, we need to look inside and outside of the box for good pelvic health. And so the content that I kind of put out there on social media is educational. There's some exercises. I just want to make what can sometimes feel complicated, like concepts that might feel complicated or feel scary, um, or simply things that we don't talk about. I just want to make them something that is easy to understand, that we can talk about it without shame or judgment or fear. So that's what you're going to find. You're going to find like easy, accessible exercises, information, and education. That's what you'll find on like my social media and my website and stuff like that. And then I do have some on demand courses, which are more geared towards helping people prepare for pregnancy. So, preparing for birth, preparing pelvic floor, like pushing and positions and all the stuff that we had sort of touched upon, as well as preparing for postpartum. So, thinking about planning those early postpartum weeks of recovery beforehand, what you need, what to expect, what's reasonable for tissue healing. How can you accelerate your tissue healing? What to keep an eye out for? How do you return to kind of activity in those early weeks where at that point, like, no one cares about the mom anymore. Everyone is focused on the baby and how the baby's sleeping and how the baby's eating, but you just went through some things. So I have a couple of courses, which are on demand, so you can just do them as you'd like. But then I also have like a video-based exercise program called the Pelvic Floor Mobility Program. And that has over 30 videos that are focused on really all the different ways that we can manage our pelvic health, from strengthening of the pelvic floor alone to deep core strengthening to functional strengthening to pelvic floor muscle release and stretching and mobility, full body mobility, breath work, stress management, because all of these things play a role in pelvic floor kind of health. And when it comes to prolapse, it hits all of those things as well. So in that program, you'll find specific routines for prolapse, for stress urinary incontinence, for pregnancy, for postpartum, for perimenopause, for like all different kinds of things. So that program exists. It is something that you can follow at your own pace. It's all video based. All the videos are like 10 minutes or less. So not trying to make you do like 60 minutes of exercises, but more to supplement what you're already doing or to help you get one foot in the door and start moving a little bit more regularly.
You see patients in person?
I do. In Toronto, I have a clinical practice downtown Toronto, and I do see people there. And I see people virtually in Ontario.
Well, this was lovely. Who knew? Like, such a niche topic, and you can just make an entire episode about it. And like,
and we didn't even
learned
talk
so
about
many-
so many things.
I know. This is what always happens. Like, I think I'm going to do an episode with someone and like cover all these topics, and it takes so much longer. Like,
Yeah.
because there's just, and I have so many questions and obviously things that side notes that have nothing to do with the episode because that's just who I am as a person. But
that's what makes
Anyhow.
it fun.
yeah. Well, thanks for coming on again. I'm sure I'll have you back on in a little bit because I'm like starting to have regular guests that I just have on all the time. And I feel like
love
you're
that.
one of those people.
I love that. I'm
Yeah.
honored. I love chatting with you. It's always funny and fun.
Well, thank you so much for coming on. And everybody check out Box Wellness Co. on Instagram and her website as well. Well, thank you.
Thanks, Renee.
And I'm on a roll.